Being a paramedic, you have a chance to get out there in the community and save people.
Open your eyes.
Where's Mom?
They're in their darkest hour and they just hand you all their trust and say, here, you help us.
Our priority is just to make sure that you're okay.
I really enjoy going to someone and turning that frown upside down.
Give me a big smile.
We've got you.
Delivering a patient to hospital in a better state than what they were in is phenomenal.
He'll be all right.
Mum, I love you.
They're like angels.
That's it. Stop CPR. He's got a pulse.
Being a paramedic has taught me life is precious and you shouldn't take a second for granted.
On this episode of Paramedics,
Heart rate's 100, stats 100%.
Simon and Michaela treat a heroin overdose patient
He's just take a breath in to now have a go.
and are able to mentor a paramedic graduate at the same time.
It's a really good opportunity because we do know that she's going to go to a lot more overdoses and unconscious patients in the future.
Can you wake up?
Deep breath for me.
Steve and Jade make life a bit brighter for a terminally ill patient.
She can no longer walk or talk, and I can't help but worry that her breathing muscles are about to give up too.
You are a queen. I love them.
This is the kind of stuff that makes me want to come to work.
Next year's the year you're meant to start rebelling and be real naughty, isn't it?
And distraction techniques, Mike and Eamon style.
Joking around, it's actually a clinical intervention for us.
I used to get in trouble in high school. I turned out okay.
So Bianca plucked my eyebrows last night and they are on point.
Did she?
Oh, mate, surely Renee does that for you.
No, mine are pretty tame.
Oh, mine are bushy.
Longtime partners Mike and Eamon are discussing their beauty treatments.
I let Renee fake tan me once or twice.
Oh, yeah.
She got a bit excited and I looked like I'd been sort of walking through the Sahara for many a week.
Days and days with no water.
Yeah.
Tell you what, cuticle care is good though. You could do some cuticle care,
my
mate.
nails are in
Yeah.
strife.
Get some cuticle care, man. Oh, it's absolutely fine for guys to go through the beauty care regime. You want to look good, you want to feel good, go for it.
Emergency services. Okay, tell me exactly what happened.
So a boy was playing out on the artificial turf playing footy and he fell backwards and hit his head.
Meanwhile, at the Emergency Services Telecommunications Authority, a school is on the line about a 13-year-old student.
The teacher has witnessed him down on the ground having a seizure and so he had blacked out.
Okay, are you with the patient now?
Yes, he has a massive headache.
Okay, so do not move him unless he's in danger and do not splint any injuries. Just reassure him that help is being arranged and tell him to be still and wait for help to arrive.
Here we go.
RC 139.
Bit annoying.
We're going to a 13-year-old male. He was playing sports, fell and hit his head.
Okay.
And then was witnessed to have a seizure for about 30 seconds.
Okay.
He's now alert with a bit of a headache. Fair enough.
Fair enough.
A seizure is essentially an uncontrolled, unregulated firing of the neurons in your brain. It results in body twitching, a loss of consciousness, and sometimes it can affect the patient's breathing. And then there's a period of time afterwards where they're quite groggy and quite confused.
Has he had a seizure
and fallen,
or has he fallen and had a seizure? And one is much more sinister than the other.
Yeah.
Having a seizure is never a good thing, but if the patient has hit their head and then had a seizure, that tells us that they may be having a really serious head injury.
One clear, three clear.
We've got to get there quickly. If this boy is having a seizure after a head injury, that indicates to us there might be some bleeding in the brain, which is not good. The skull only has so much volume in it, and if we add blood there, it literally starts to push the brain out through the hole in the bottom of the skull, and that's critical.
The school staff has been careful not to move the student from where he fell.
Hello, mate. What's your name?
Willem.
Willem, tell me, what's happened, mate? Do you recall any of it?
Oh, no, hearing from the teachers, I was playing footy and hit my head.
What I saw, he hit the ground.
Okay.
His body hit the ground first, and I think his head
falling back and hit his head.
And then I saw his arms go up, as in that telltale sign that you've been knocked out.
Well, you sort of just gone stiff almost?
That sort of fingers
gotcha.
go up. You know,
yeah, gotcha.
Always tried to lift him up, and that's when he started seizing.
Okay, and it was sort of, all his limbs were sort of shaking and whatnot?
Yeah.
And how long did that last for?
It felt like eternity, but probably about 30 seconds.
And he's definitely fallen, hit his head and then had the seizure. He wasn't having any sort of seizure activity prior, and that's caused him to fall?
No.
Yeah, gotcha.
Now it's clear Willem's had a seizure after falling. He could be in real trouble. There could be some bleeding in the brain, and that's life-threatening.
You keep your head there, mate. I don't want you moving your head.
RC 139, Roger, code 2.
Partners and friends Risky and Nicola have been called to a head-on collision. It's a non-urgent code 2 as the fire brigade is already on site, but they are worried about one of the drivers.
So we're off to a 78-year-old male. Car v car.
Yep.
Patient hit chest against the steering wheel, complaining of some chest and back pain.
How old?
78.
Could be significant. So my immediate concerns are his age. He's 78 years old. That puts him into a high category of serious injury. Brittle bones can cause more fractures than someone who's young and fit and healthy, especially with the chest area. And obviously under there, we've got lungs and heart.
Nil airbag deployment.
If it was significant impact and those airbags haven't deployed, then that layer of protection isn't there. So there's more risk of more serious injuries.
I got my car as soon as I turned 18, and then I wrote it off. I would have been 19, I was in like first year uni. Someone merged into the lane and the person in front of me slammed their brakes on, and then I slammed my brakes on, hit them, and then someone slammed their brakes on and hit me. So goodbye, old Corolla.
Yeah, hello.
Next Corolla.
So many people have car accidents and they can have really serious outcomes. I'm lucky that with mine, all I did was ride off my car.
I actually had a car accident pretty much right where we're going now.
Oh, really?
Yeah.
Your fault?
Whose fault really is it?
Well, generally someone's.
No, so the traffic stopped suddenly, and I was doing a head check and then ran up the back of the car. So yeah, it's my fault. Car accidents can be really stressful, but luckily for me, no one was hurt, so I can have a laugh about it a few years later. Here we go. 1, 2 cars.
The fire brigade has moved both cars to safety, but while one driver is fine, the other has only got worse.
Hello, how are ya?
Good, this is the driver, this is Milton.
Sure.
78.
Yep.
And his heart rate's 65. It's got him on 8 litres per.
Yep.
And he's hit his chest and...
Yep, Milton.
Yeah.
And so he was obviously driving, so he's got out of the car.
Yep.
And walked around there himself.
Yep. She's coming down the inside lane at speed, 60k.
Speed plays a massive role in car accidents. Anything over 60k instantly tells us that there's a higher chance of significant injury to the patient.
Did you hit your head? Okay. Have you got any neck pain if I press on the bones here?
Let's go on the neck,
And you remember hitting your chest on the steering wheel?
Oh, yeah.
Yep. Okay.
An accident at 60 kilometres an hour when the airbags haven't been deployed can mean rib fractures, sternal fractures, and if they actually break off, it means that it appears the lining of your lungs or even your heart, which is life-threatening.
What's sort of the last thing you remember before coming to you?
I remember playing footy before.
Yeah.
Mike and Eamon examined 13-year-old Willem, who's had a nasty fall playing sports at school.
And you've never had a seizure before?
No.
And you'd been otherwise well in the lead-up to today?
Yeah.
Not only has Willem had a fall and hit his head, he's also had a seizure as a result of that fall. It tells us that he may have a bleed on his brain. Bleeding on the brain is about as bad as it gets. Patients can have lifelong disabilities, and in some cases, they can die. Do you want to get the bed, Cole? I think we're going to have to go up to the kids based on that seizure activity, I think.
Oh, yeah, I agree. All right, no worries, mate.
I'm just going to check, while Foxy here goes and gets the stretcher and stuff, I'm just going to check a few more things, mate. I want you to reach up, grab my fingers, give him a really big squeeze, hard as you can. Pull me towards you. Now push. That's really good.
Testing a patient's grip strength helps us understand their neurological function and if there is any impingement on that function.
All right, just keep your eyes nice and wide for me.
And bleeding on the brain can increase pressure in the cranial vault. One way that we can see that is through unequal pupils.
That's good.
But even though our tests are coming back good, we don't know if in 1, 2 or 3 hours from now, there'll be so much pressure in his head that we will see some of these scary signs.
I don't want you moving your head too much because we want to try and protect your neck until the docs can have a look at that, okay? But I am just going to have a little feel and you tell me if it's tender anywhere I'm pushing. Is there a particular part of your head that's sore?
Oh, sort of like around here.
Just keep your head back there. Just over the sort of the side?
Yeah, they're right there.
Right there?
Yeah. It's not like too sore, it's just achy.
Yeah, I mean, you whacked your head on the sports field, so that's understandable.
We can't be sure that he hasn't done some damage to his spine as well.
All right, my friend. This just goes around your neck.
So this collar is going to help keep his neck nice and still and prevent any further damage.
Let's sit up slowly. Keep your head nice and still. That's it, mate.
Is that your mum over there?
Yeah.
Give her a wave, let her know you're all right. Hi, Mum.
1, 2, 3.
Good, man. Jeez, you're almost taller than we are. Take a seat on here for me.
Oh, keep that neck nice and straight, mate.
Oh. Come on over.
Hello, Mum.
Hello.
What's your name?
Kerry.
Kerry, I'm Eamon, that's Mike.
Hello.
So there doesn't appear to be any sort of impairment of his neurological function, but it's concerning that he's fallen and then had a seizure. Like, it's a pretty nasty sort of head knock to have a seizure after that. So we'll take him up to the Royal Children's Hospital because they're a great trauma centre for kids. They'll scan him from head to toe, work out what's going on.
It's got to be incredibly stressful as a parent. I cannot imagine what's going through Willem's mum's mind at the minute. Let's get you out of this wind, mate. Then we'll do a few other checks. This is a serious incident. Eamon and I are pretty worried about Willem.
It's going to have to be a gentle one up to the kids.
Yeah, no dramas, mate. I think that's a wonderful plan. Brain bleeds can develop quickly or slowly, and that's why they're quite insidious. The patient can look fine right now and then in minutes to hours deteriorate really, really rapidly. And then if a brain bleed isn't treated properly and quickly, it's fatal.
Keep looking up, okay?
So, 60 Ks with no braking.
Okay.
Nicola and Risky, a worried 78-year-old Milton, could have serious injuries after a 60 kilometres an hour front-on collision with no airbag deployment.
So he's got what sounds like traumatic sounding chest pain. He does have some tenderness in his cervical spinal palpation.
With tenderness on spinal palpation, I'm immediately concerned of potential for a fractured vertebrae, and this could ultimately lead to spinal injury.
This is just to protect your spine, Milton, okay? And I'm just gonna untuck your shirt there. Have a look at your heart really quickly.
There's also a risk that Milton could have bruised his heart, which could cause cardiac failure.
Good.
Whilst the ECG doesn't show anything immediately concerning, he definitely needs to be seen at hospital.
There we go. Just spinning around towards me, that way. Yeah, it's a bit cramped in here, sorry. Sitting down, that's it.
Because Milton was walking around at scene before we arrived, we've deemed it safe enough for him to take one little step out of the car and then onto our stretcher whilst we keep him nice and still and in alignment of his spine.
That's right, we're not going anywhere just yet.
Milton was on his way to pick up his wife Layla from work. Instead, a friend has rushed her to the accident scene.
Is that pain worse?
Yes. More up a little bit.
You need to go more up?
It's putting pressure on here, is it?
So you need to be sitting up more?
That's okay.
It's really a bad accident, so I go immediately inside the car and comfort him. But he cannot talk much because he has bad chest pain. I'm so nervous because I'm scared what's gonna happen.
Just take a big breath in for me. That hurts, yeah. Yeah. She's got real red over kind of like the sternal.
Oh, God.
Was that in the chest?
That's painful, yeah.
All right. All right. Chest is clear with equal air entry
Just because Milton's chest is clear, it doesn't rule out serious injury to his ribs or even his sternum. And because of his age, the speed of the accident, and the fact that he's got chest injuries, he has a high potential to deteriorate.
How bad's that pain out of 10, Milton?
Probably like 7 or something.
A 7, okay. We're going to work hard to try and get you a bit more comfortable, okay? All right, little sting. Milton, this drip here hasn't worked, unfortunately, but we're going to give you some pain relief up the nose, okay?
Okay.
Milton's veins are quite hard to find to be able to cannulate. So in order to get pain relief on board ASAP, we're going to give him some pain relief up the nose of a nasal spray.
All right, I'm going to count to 3, then I'll squirt. 1, 2, 3. 1, 2, 3.
The most time-critical aspect of Milton at the moment is what we would describe as undiagnosed pain. You know, we don't know where that pain is coming from, whether it's his organs or his bones.
They've got your number if they need to call you, okay?
It must be so hard for family members to turn up to these kind of scenes not knowing what condition their loved one is in.
All right, we'll get you to hop out.
My major concerns for him are damage to his heart or his rib fractures could have pierced his lung. And that's a problem because your lungs can end up collapsing and then he can't breathe, and ultimately that's a life-threatening situation.
I will come and see you.
Okay.
Okay?
Yeah.
Okay. He's my husband. He's my life. He's very important to me.
Take a seat right there. Kerry's going to come with us.
Beautiful.
It's perfect.
Mike and Eamon are setting off to hospital with Mum Kerry and her son Willem, who got a nasty head knock playing sports at school.
You don't want to be left alone, do you?
It doesn't matter if you're 13 or 35. It always helps to have your mum there to give you a little bit of TLC.
So Eamon's just getting him plugged into everything. Blood pressure, heart rate, oxygen, sugar, temperature, all very normal. It's just this shaking activity that lasts for about 30 seconds, and the teachers here seem very, very switched on to what was going on, which was great.
Yeah.
So the things that we worry about are a small amount of bleeding. That's why we go to the Royal Children's, because they can fix all those things.
Yeah.
Beautiful.
All right. I think we'll do a gram of paracetamol and 4 of Ondansetron.
Yeah.
I think we're good to go, mate.
Sounds wonderful.
Yeah.
Even though Willem's alert, talking to us, he seems to have recovered quite well, that can sometimes be a bit of a red herring. They can have a lucid period where there's some bleeding in the brain that's slightly resolved, and then the patient goes on to deteriorate. So it's absolutely vital he goes to hospital.
While getting there quickly is a top priority, it's equally important to keep Willem calm, so the siren is not used.
So 13, mate, you'd be what, year 9?
8.
Next year's the year you're meant to start rebelling and be real naughty, isn't it? Year 9 is like the year you go up a cliff.
I think it's already happening.
Have ya? You been getting in a bit of trouble this year?
Oh, really?
Any detentions?
Maybe 1.
Maybe one.
That's it. That's it.
I used to get in trouble in high school. I turned out okay. You'll be right, mate.
It's important to keep people relaxed when we think they might have a bleed in the brain, because the more anxious you are, the higher your heart rate, the higher your blood pressure is. When they get higher, blood enters the brain more quickly, and that can worsen bleeding.
When we were driving here, I thought, I bet she's got maths or science after this.
Maths test.
Maths test. Good job, mate. You just got one of the boys to push you over and no maths test for you.
Yeah.
Did you play footy outside school?
Yeah.
Mate, you got the mullet going. It's not a bad look. Business at the front, party at the back.
By lightening the mood, we also keep his mum relaxed, because if she's distressed, it's going to stress him out. So joking around, having a bit of banter where appropriate, that's actually a clinical intervention for us.
Still feeling all right?
Yeah.
Good. It all looks reasonable at the moment in terms of his vital signs. The concerning part is the seizure.
Yeah.
Because we get such a limited view into what's happening at the moment.
Yeah.
You know, that's for the hospital to kind of work out.
All right, here we are.
We've got Willem to hospital safely, but the reality is he's going to need to be monitored closely for the next 4 hours, just in case a head injury does evolve and he does deteriorate.
Come on over, Kerry. He wants to see you. He doesn't want to see us. Hopefully, he'll be out on the footy field with his parents cheering him on in the future, but we just can't be sure.
All right.
How's your pain going? Is it still quite uncomfortable?
Yeah, probably like 6.
Okay, I'm just going to give you some more. 1, 2, 3.
As Milton's crushed car is taken away,
All good?
All good.
the 78-year-old sets off to hospital. Worried wife Layla will meet him there.
So travelling approximately 60.
Yeah, and with no braking.
So you've got the pain in the centre of your chest there, Milton.
That's right.
Okay. It's possible that you've fractured your breastbone, the sternum, and given the speed of the collision and your age, we're taking you into the Royal Melbourne Hospital, okay? How's your pain going, Milton?
Not real good.
All the bumping around making it worse?
Yeah, I can feel it, yeah.
Yeah.
It's hard to tell if it's the bumps that are making it worse or there's something else going on. So we need to be really cautious of that and manage his pain and get him to hospital as soon as possible.
So we each nostril again. 1, 2, 3.
Things can change. My major concerns for Milton at this stage still would be damage to his lungs or air escaping and bruising on the heart.
How long have you been married?
17 years.
17 years. That's nice.
Yeah. I had a medical with my doctor 2 months ago.
Yeah.
And everything was very good.
Okay.
Yeah.
Great.
I empathise with Milton. He's a 78-year-old man, generally in good health, who was going to pick his wife up from work, and now this has happened out of the blue. And it has the potential to impact the rest of his life.
How's your pain going?
When I'm breathing, I can feel it worse.
Yeah. We're just pulling in.
Okay.
Sorry, Milton. It's just the driveway.
Milton will be taken straight into a trauma bay where he'll be reviewed by the doctor. He'll have x-rays and scans and they'll work out exactly what's going on. I'm hopeful he'll go back to living his normal life, but unfortunately, with his age and these type of injuries, you just never know.
All right, Milton, I'll wheel you inside, okay?
Emergency services. Okay. Can you tell me exactly what happened?
This is our friend Anne who's got motor neurone disease, MND.
Yep.
And she's absolutely struggling to breathe.
And she's pale.
A terminal disease sufferer is in distress, with her friends and carer desperate for help.
Does she have difficulty speaking between breaths? She can't speak because of her motor neurone disease. Okay. She's non-verbal. Is she clammy?
Yeah, she's clammy.
Okay, we do have that help arranged. They're coming as fast as they can.
C139 received.
Paramedics Steve and Jade are racing to the scene.
Went to a 69-year-old female who is short of breath, and it says that she's got a history of motor neuron disease.
Yeah.
So there is a potential that she could be quite 60.
Yeah, the poor soul. Motor neuron disease.
So motor neuron disease, or MND, progressively damages parts of the nervous system. And that leads to muscle weakness throughout the whole body, and there's currently no cure. Eventually, walking, talking, and breathing become impossible.
So just be mindful of, I guess, our oxygen.
Yeah.
Sadly, MND is a terminal disease that has a life expectancy of only about 3 years.
All right, we're here. Bring the oxygen.
Yeah, oxygen, please. Hello.
Now, this is Anne in here.
Anne.
Yes.
What was your name?
Jan, I'm Jan.
Jan and Anne.
And this is Sam. One of the carers.
Jan, Anne and Sam.
She's got MND. Anne's got MND.
Hello. I'm Jade and Steve's coming in.
My first impression of Anne is that her disease is quite progressed already. She is unable to speak, so she has an iPad to communicate with us. She's already connected to supplemental oxygen. And Anne's potentially getting worse tonight.
I came across at 7:30 and Anne was gasping.
Yep.
Breast.
So we put her on oxygen. That's helped a bit. I asked her and it's sort of like a choking feeling.
Yep.
Yeah.
Which is something that usually happens to her?
No,
Well,
this is
yeah,
new.
This is new. Okay.
This is new.
Does she normally wear that for sleeping?
Yes, she does.
Yep. Could we take it off her and I can do an assessment?
Yes.
Is that all right? Anne, do you mind if I move this out of the way? And I put some stickers on you. Is that okay?
Although Anne's gasping has seemed to have calmed down a little, this new issue tonight could be a further progression of the MMD.
All right, pop this on your finger for me. It's just going to check your oxygen.
And I can't help but worry that the inevitable is happening now and that her breathing muscles are shutting down, and that'll be the end of her life.
Emergency services. Okay, tell me exactly what happened.
So I just walked past the public toilets and it looks like there's a guy overdosing.
Do you know what he's taken?
He's had heroin.
How old is he?
I'd say probably early 20s.
And is he breathing normally?
It's quite shallow.
All right, we're just got to quickly test it together. So I want you to say now, every single time he takes a breath in, starting immediately.
I feel like he's... Oh, now?
Yeah, and again. Has he taken another breath? Sir, has he taken another breath in at all?
No.
All right, now an ambulance is being sent. Is there a defibrillator available?
No, there isn't.
Okay, listen carefully and I'll tell you how to do resuscitations, okay? So you've got him flat on his back?
Yep.
Mike 30 received.
For intensive care paramedics Simon and Michaela, it's an all too common call.
So Simon, we're going to a patient who might have taken an overdose. How many drug overdoses have you been to over the years? I can't even count how many.
Hundreds.
Pretty sad. People in their 20s, it's usually party drugs. It's not heroin.
Yeah.
Heroin has a number of effects on the body. The main one is respiratory depression, meaning that the patient might be breathing inadequately or not breathing at all. And eventually, the lack of oxygen will cause brain damage, but it'll also cause their heart to completely stop. Oh, they're ventilating him.
Another ambulance crew and the fire brigade arrived only minutes earlier.
I'm not even sure what his name is.
Yeah.
But basically, he's gone into the toilet, ingested heroin of an unknown amount.
Yeah.
He's come out unconscious.
Yeah.
On arrival, GCS3, rest rate of 4.
A GCS of 3 means the patient's heavily unconscious, and a normal respiratory rate is between 12 and 16. So a respiratory rate of 4 is grossly inadequate in delivering the oxygen the brain needs.
I'll just help you there. Really lift his jaw and I'll ventilate.
Essentially, if the patient wasn't being ventilated, his brain would be dead within 10 minutes.
She's taking that gasping of the breath. She's actually not getting that oxygenation in that she should be.
69-year-old Anne is suffering from motor neurone disease, which progressively weakens the muscles in the body until it simply shuts down for good.
She was just white. And that was what, every 5 minutes we're sitting her forward.
Best friends Jan, Jason, as well as carer Sam were horrified when Anne suddenly started gasping for air only minutes ago.
36.7. Your temperature's good. And any issues with diabetes?
No, but she's got a peg.
She's got a peg. That's how you feed her. Yeah. Cool. You got your peg in here. You show me? Oh, yep. There you go. Not bad. Is it hard to look after? No?
Anne's health is on a knife's edge. Her muscles have become so weak she can no longer walk or talk. And a peg is a feeding tube that Anne needs because she's unable to eat or chew or swallow properly.
Do you have any pain if we sit you forward, Anne?
I'm just going to listen to your chest. Is that okay?
And my biggest worry is her breathing muscles are about to give up too.
Deep breath for me.
Good job. Anne's breathing quite heavily, but that's actually quite normal for someone in the late stages of MND.
Very good. There you go. You can relax now, my love.
But we still need to do a thorough examination because she could take a turn for the worst at any moment. How long have you had the diagnosis for?
Since July. Last year.
Quick.
Wow.
Really quick deterioration.
That's tough, Anne.
Yeah.
I'm sorry to hear that. But you look like you've got some lovely people caring for you, though.
Anne is the best friend ever. She is fantastic. Absolutely love her. Before MND, beautiful, but still beautiful today.
Just full of life and...
That's it.
And even with it, she's still, we joke with her every day and,
she's just exactly the same. Yeah.
So probably 18 months ago, we just noticed that Anne's voice was getting slower and slurring, and she was joking, I think sound like I'm drunk. And then she fell over a few times at work, and then she fell over one time here when I was here. And then she went off and they did a whole raft of tests, and that's when it came back that she had MND.
Close your eyes, and then when you open them, I'm going to shine a light in them.
I'm just grateful I'm not in that situation, and I can't imagine what she's going through. So anything I can do to help is what I do.
All right.
Absolutely devastated, because if you're diagnosed with something else, like cancer or something, you know that there might be a chance, but in the last couple of months it's been rapidly getting worse, and that's not going to end well.
We've got a good blood pressure, 120 on 80.
Yep.
Heart rate's 100, sats 100%.
Yep.
We've got a rest rate inherent of 4, so we're just supplementing him here.
Simon, Michaela, and another paramedic crew, Emma and Georgia, are urgently treating a man who has overdosed on heroin.
I'll ventilate.
It's made him unconscious and slowed his breathing to a life-threatening low rate.
Well, let's have a good look. There's no other injuries on him. Simon can drop some naloxone. Yeah.
Initially, we address life threats, so airway, breathing, circulation, and then once the oxygen levels are restored, we administer naloxone, the drug that reverses the effects of the heroin.
I'll show you. Hold the mask like that, and then you lift the jaw up with your little finger.
It's critically important that we normalise the patient's oxygen levels, because it'll stop further brain damage. But also, when they wake up, if their oxygen levels are low, they can wake up agitated and can be violent.
Now he's just take a breath then, so now have a go. You got to get right in there, but keep practicing, because it's really good practice for you. So if your waveform kind of goes, it means that your seal's not there. Yeah.
One of the paramedics on scene is a graduate, meaning that it's her first year on the job. So it's a really good opportunity to run through some techniques and some skills with her at the same time of managing the patient to build her confidence, because we do know that she's going to go to a lot more overdoses and unconscious patients in the future.
So I think, girls, we've been ventilating him long enough. He's not hypoxic, so he shouldn't wake up agitated or anything like that. Yeah. So have you given an IM before?
Once, yeah.
Do you want to give this?
Yeah, sure.
Yep. All right.
This is a great opportunity to empower the young paramedics. So with critically important skills, basically our intervention can be the difference between life and death for this patient.
So 5 mils, which is 200 milligrams. So what you do is 2 fingers, so from his hip down, and from his, well, he's got quite a long knee, but this is your space here. So, yep, that's fine. He's quite thin, so you might hit the bone when you go in, so, yeah.
So we'll just note the time.
Naloxone usually takes 1 to 3 minutes to work, but my worry for this patient is that the naloxone going in won't make a difference because his brain's been starved of oxygen for far too long. So he might have already had a brain injury by now. Or worst case scenario, he may never wake up.
Your heart rate is good. Your blood pressure's good.
Steve and Jade have almost finished examining motor neurone disease sufferer Anne.
Your oxygen is perfect.
Friends Jan, Jason and Kara Sam called the ambulance when Anne was struggling to breathe earlier.
How do you feel now? Good. Good. Do you think that she looks like she's come back to normal?
Yes.
Yeah. What would you like to do? Would you like to stay home?
Oh, yes. Oh, yes.
Yeah, I know.
For Anne, it's really important to keep her comfortable in her own home, surrounded with people who love her. Because taking her to hospital is not going to fix the problem, because there's currently no way to fix it.
Are you guys comfortable with that?
Yeah, we're fine.
Yeah.
Thank you.
But if we drive down the street and there is any change, you just call us back.
Done.
she appears to have come through what's happened, but these episodes are going to become more frequent for her, and eventually it will be life-ending.
How are you feeling now? Yeah.
Couple of giggles.
Good. Anne doesn't seem to have lost any of her brain function, and she could communicate with us through the iPad, which was fabulous because we still got to learn her story.
I worked for the City of Melbourne for 26 years. I was responsible for harm minimisation, crime prevention and community safety. I loved going to bars in the city after work and spent my weekends in galleries and ballet. I hope to be a bar flight 90 dressed eccentrically with a martini in there. The worst thing about NMD is that I don't English speak, as I love talking, asking questions, laughing out loudly, and sometimes interrupting people.
Probably the toughest thing about MND to wrap your head around is that it's really random. They don't know why people get it. So we've got to be grateful for what we've got, because it could be any one of us sitting in that chair experiencing her story too.
Glasses?
Where are they?
Oh, these bad boys. You are a queen. I love them.
It is incredibly sad that Anne probably doesn't have a lot of time left, but she hasn't lost even slightly the beautiful bright spark that's on the inside.
It was delightful to meet you.
Lovely to meet you.
Look after yourself. And again, if you need us, bring us back.
Yes, thank you.
All right?
We could learn so much from Anne and her positivity in facing something with such adversity. This is the kind of stuff that makes me want to come to work.
Thanks, guys. Take care. See you later.
So in the next couple of minutes, we might see that he starts to improve his conscious state. Yep.
Simon and Michaela wait for medication to work that will hopefully reverse the effect of their patient's heroin overdose, so he can regain his consciousness and start breathing unaided.
So there's two ways you can hold. You can do like a C grip like this, or you can do like this one.
It's a case junior paramedic Emma will have to get used to, with 1 to 2 people dying every day from opioid abuse in Australia.
Do you want to have a go from where I am? Yeah, you have a go.
Hands-on and on-the-job experience is priceless for paramedics. It's the best way to gain confidence and gain competence in the skills you're performing on a day-to-day basis.
Open your eyes. Can you hear us?
Naloxone takes 1 to 3 minutes to work. It's a nervous time because there is a chance he could wake up combative and put himself and us at risk. And we don't know whether he's incurred any brain damage. I just hope he's going to live. I find it sad when I'm ventilating a 20-year-old, but it's much worse when I arrive and they're dead.
So in terms of like him going to hospital, he's had some CPR done. Yeah. So it's always advisable that they go. Yeah. Usually they decline and refuse and say no. We'll try and get him seen, especially because he's been unconscious for quite a period of time as well, and he's a flat GCS 3. Yes.
Because he's had CPR, he could have rib fractures. But following an overdose, these patients, they generally don't want to go to hospital because they're embarrassed and they may not want family or friends to know they're using drugs.
Can you wake up? There you go. Hello. Wake up. It's okay. It's okay. It's the ambulance. Everything's okay. It's okay. You're not in trouble. Everything's all right. It's the ambulance. Sit up. Just wait.
We're fortunate this patient hasn't woken up aggressive. These scenes can be quite scary for us as paramedics, so it's really good that he's just a nice guy that needs help.
Hold on. Just be careful. Don't rush yourself up.
There we go.
Can we take you to the hospital? Yeah, you've had some CPR done on your chest.
It's a great relief that he said yes to going to hospital. This means that they can monitor him for rib fractures, but more importantly, he could get some drug counselling.
Just take a seat on the bed. Go sit on the bed.
And we'll cover up. We'll cover up. Yeah, you got to sit right up. You got to sit right up.
You can turn that inside out. It's all inside out.
He's clearly coming to terms with the gravity of the situation. He's cold, he's scared, and he's just had a near-death experience.
I really hope that today's a wake-up call and from here, he gets the help that he needs.
I'll leave you with it.
Yeah,
thanks. Cool.
It's a sad reality that if no one had come across this man, he eventually would have stopped breathing, his heart would have stopped beating, and he would have passed away.
Bye.
Thanks for your help.
Look after
See ya.
yourself.
And you've never had a seizure before?
It's been 10 weeks since 13-year-old Willem hit his head hard enough to have a seizure. Mike and Eamon were worried it was a sign of a dangerous bleed developing in his brain. Luckily, thorough scans at hospital cleared him of this condition. He did, however, have a concussion. In the following week, he suffered short-term memory loss and headaches lasted a lot longer, but he's finally now well enough to play sports again.
Oh, God.
78-year-old Milton was taken to hospital with severe pain in his chest after a high-speed front-on collision. X-rays confirmed his sternum was broken and he was kept in hospital under close supervision for 5 days. Recovery will take months, so Milton is happy to have wife Layla supporting him every step of the way.
Anne was gasping.
Steve and Jade were called to MND sufferer Anne's home when she struggled to breathe. Although she made it through that night, sadly, 7 weeks later, the disease finally took her life. Longtime friend Jason fulfilled a promise he'd made to Anne, and she took her last breath at home, surrounded by the people she loved. While MND ended Anne's life, it did not define it. The funeral was held at Melbourne's Grand Town Hall to acknowledge the lasting positive legacy of the work she'd done to improve the city's community safety.
Anne's story is incredibly heartbreaking,
You are a queen.
but it's inspiring that while struggling with a cruel illness,
She was linked to us. Sadly,